Hey everyone, welcome to the Slice of Healthcare Dental Podcast. I'm your host, Jared Taylor. Joining me today is Andrew Smith, the CEO at the Association of Dental Support Organizations. Andrew, how are you today?
I'm great. Thanks, Jared, for having me.
I'm excited to have you here. Let's dive right in. First off, for those that maybe haven't heard of the ADSO, give us an overview of the work that you're doing.
Yeah. So thanks. So the Association of Dental Support Organizations, we're an advocacy organization that represents and advocates on behalf of the dental support organization community. So very focused on public policy advocacy related issues. How do we, kind of promote workforce, through licensure portability, insurance reform, and then also working with the next generation of dental students. So looking at kind of connecting and promoting workforce initiatives and really just kind of being that resource for students as they determine what their next career choice is, and DSO is a potential pathway. But we're really there just to support the industry and be involved with all things dental.
And you took over almost 4 years ago, right, as CEO. Talk me through what made you come to this organization for almost 4 years ago?
Yeah, no, it's a great question. So, in full disclosure, I don't have a dental background, kind of recovering DC political lobbyist, if you will. So I worked in and out of government campaigns, government for a long time. Worked on Capitol Hill, worked on K Street, doing lobbying. And what really attracted me to the DSO space is when I met some of our board members, in particular those that were the founders and current CEOs of many of the largest DSOs. I was very impressed with their entrepreneurial mindset about, you know, how can we create more efficiencies and continue to make dentistry more affordable uh, for patients, more accessible for patients, and also how do you better serve the profession and the dentist, and kind of where was the puck going and how do you really engage in that. So I was really impressed by their thoughtfulness, their entrepreneurial aspect, and being very strategic. And having worked with other trade associations in the past, what I found particularly interesting was that our board is made up of all of the CEOs, as opposed to, just say a general counsel or another government relations professional. It's the top of the ticket, if you will, is very invested in the association and the industry. And I thought that was a great opportunity to kind of take the bull by the horns and work on with them.
Interesting. I feel like your background too, though, helps in so much of what even though you said you don't come from the dental world, right? Your background helps, especially if, a big part of what you're doing, you are still in DC, right? Having these conversations. So those relationships that you built and everything, I'm sure come in handy.
Yeah. Yeah, no, absolutely. I mean, I think what comes down to it is like, how do you identify issues of alignment throughout the board and the industry as a whole, not just DSOs, but all different types of practice models that's great for the dentist and ultimately the patient? And then kind of how do you drive those public policy changes that are going to benefit the whole ecosystem? And so, we can probably chat about some of the initiatives we're working on and things like that, but it's, it's an exciting time. Dentistry is more so unified than ever before. So there's a lot of things to be able to get done.
When you look at the DSO model, how do you see the role of DSOs evolving in the next, say, 5 to 10 years, especially as patient expectations and technology continue to advance?
Yeah, I mean, I think it's twofold, right? I think it's, what does this next generation of dentists want in terms of a working professional life as a dentist. And then second, you're 100% right. It's the patient and their expectations. So I think it's twofold. So if you start with the dentist, um, you know, these kids coming out today, it's pretty cost prohibitive to open your own practice like it was, 20 years ago, even 15 years ago. You come out with a lot of student debt. It's harder to buy into a practice. It's harder to start your own practice. Many of the students that I meet with and talk with, I was just at last week at the University of Indiana. Many of them don't want to do the business side of dentistry. They got in because they want to help patients. They like the clinical side. That's what they're trained to do. And that's kind of where the marketplace has been evolving. So I think DSOs offering that opportunity to say, you have your clinical autonomy to do what is best, and we're going to be that business support for you to do all things dentistry, and you can focus on the patients and the clinical care, and it's a win-win for everybody. I 100% agree with you on the patient side of things. More so than ever, there's this rise of consumerism within healthcare and particularly within dentistry. So when you look at certain technologies, I'll give two as an example. So you look at artificial intelligence and then other things like salivary diagnostics. And the reason I mention those two is, AI is a huge tool for the patient to better understand why the care is needed, right? So you look at the AI to say, okay, if this is left untreated, here is the expectation of what will occur. Here is why we're recommending it. It also helps the clinician be more efficient in treatment planning. It doesn't obviously take over for that, but it's a both sides of the spectrum. The patient feels much more comfortable with understanding why they need that treatment or a better understanding. When it comes to salivary diagnostics, another technology and kind of chair side, you can do it in quick, measures the bacteria level in your mouth, right? And so patients are better understanding of like, oh, okay, this makes sense. This is probably why I need to do this type of treatment to offset certain periodontal disease. Also, it will kind of work hand in glove with, if you have higher blood pressure or diabetes or other types of um, issues, it's kind of on both sides again of the spectrum. So I think DSOs are very well poised to delivering these types of technologies and creating those more efficiencies. A, because that's what consumers want, and B, that's what the provider, the dentist next generation wants. And they're able to kind of meet both segments in the middle. And I really see kind of, today it's about 35 to 40% of dental students graduating or going into a dental support organization. That's doubled in probably the last 10 years. And so I think it's for a lot of the reasons we just mentioned that more and more students are going into a DSO. Is one of the reasons I see that the industry continues to grow.
The common kind of term or reading between the lines that I keep hearing is the support, right? That the dentists end up getting from these DSOs. So, from your experience, you already kind of hit on some, but I'd kind of want to break it into two examples. So, how does being part of a DSO benefit a new dentist starting their practice compared to those who decide to go independent out of the gate? You already gave us some examples, but I want to frame it in that light as well.
Yeah. Well, I think, what is particularly unique is that, the investments that DSOs make with their dentist through continuing education. So as we know, the student gets trained on clinical skills, but doesn't learn the full skill set of what is really needed today in modern dentistry to meet patient demand and where, what's best for the patient. So the level of investment that DSOs provide their dentists for continuing education is huge and key. Also, the aspect of mentorship, right? So it's not just mentorship with your kind of owner doc, if you're an associate doc within the four walls of your practice, but also mentorship with fellow associate dentists throughout the whole enterprise. Many DSOs bring together their younger dentists, newer dentists to better, learn best practices, have that kind of sense of community and engagement. So I think that's a huge aspect, and also it allows them the affordability to practice without worrying too much about the business side. It gets them practice ready, gets them up and running, and so it's just an added aspect of the CE and the mentorship and the ability to kind of enter in and practice and not having to really worry about the economics yet of maybe owning your own practice and starting immediately.
Obviously, healthcare highly regulated. DSOs are no exception.
Mhm.
What are some of the biggest regulatory challenges that you're seeing these DSOs have to face? And then let's kick it over to the ADSO side of things. How is the ADSO helping navigate those regulatory challenges?
Yeah, so I think some of the large regulatory issues that we currently see is a kind of a toll gate issue, if you will, about where is the workforce available to meet patient demand and where providers are needed. So we know that many counties throughout the United States have tremendous dental shortage areas, and so just by the way dentistry is licensed state by state, there's a barrier to entry for many states. If you're licensed, say, in the state of New York and are moving to Florida, it's very difficult historically to then become a practicing dentist in Florida takes time, money, you have to retake boards, all these other things. So one of the things that we've at ADSO have done working with the ADA and the American Dental Hygiene Association, this applies to both dentists and to hygienists, is looking at licensure portability and universal licensure. So if a dentist is in good standing, graduated from a CODA accredited university, it makes it much easier and quicker for the dentist to move into that state. Because I think the other piece of this is dentistry today is different, more so than not. A dentist is not going to be in one practice for the next 30 to 35 years. They're most likely going to move, and it gives that more flexibility not only for the dentist, but also where population is going and where there's a real need for care. So sometimes removing those barriers to operate, which is, not a onerous, if you will, but it's something that's important. So we've been very, very working on that. I think also on the insurance side of things, right? So continuing to work with the insurers to ensure that the patient is utilizing the most of their dental insurance benefits, and then also making sure that the provider is, reimbursed appropriately, and really making sure that there's an established. One thing we've done in Massachusetts is we've established a dental loss ratio. So the percentage of premiums collected by the insurers, now there's a percentage threshold they have to pay out towards care, right? So it's now, I think, 83%. It might have been before only 60. So the positive of that is, yes, of course, the provider gets coverage more, but at the same time, the patients utilize their benefits more. So it's a win-win on that. And so that's one of the two kind of core things we've been working on.
Earlier in the conversation, we talked about technology advancements. So I kind of want to swing back to that now
Yeah.
as well, Andrew. You mentioned AI. One of the things we didn't mention, though, was also telemedicine, right? AI, telemedicine, they have risen in healthcare. So how are DSOs incorporating both of those technologies to both streamline operations and enhance the dental care they're providing?
Yeah, so I think what you'll see from many of our members is we're obviously a very big believer in going to see the dentist, of course, right? Like I think there's certain things that are hard to do over telemedicine within dentistry. Obviously, COVID showed that there were certain things that could be worked on. I think the biggest aspect that I can really speak to and what many of our folks are looking at is how is dentistry becoming more and more included on the medical side of things, right? So a couple, folks are very, looking at, what happens in the body also affects the mouth and vice versa. We know that the data and the science is there. Um, I think as an association, we're continuing to really showcase the needs and benefits of that and the science behind that, and promoting all of it. And I think, like you said, the technology from some of the things I've mentioned are just going to raise those factors even more. So, on the telemedicine side, it has not been as, a full focus of ours since COVID, as more and more people are returning to uh, see the dentist and the docs in person. And obviously, in order to get dental work, you got to do it in person. So, and that's the other thing I tell a lot of students is like, it's hard to, especially in this culture where everybody can work from home a lot of days. You can't do dental work from home, right? So it's always reminding of the students of like, yeah, you got to be in the office 5 days a week, kind of aspect. So but I think the technology will help streamline it, definitely.
Well, it was interesting. I mean, telemedicine before the pandemic was pretty, not flatline, but the growth was slow, right? And then it
Right.
skyrocketed, and then it dropped a little bit. But it's still, because of the pandemic, it's still at a higher adoption rate than it would have been if we didn't go through that, right? Um,
Correct.
but probably even more for dental in particular, it's a little bit more difficult to have telemedicine. Like, dermatologists obviously can do a lot of their stuff virtually and things like that, but dental, you still really do need to go in and see the dentist, right? It's
Right.
you need to. uh,
Exactly. So I mean, I think we're at the end of the day, we're supportive of what helps make our clinicians better clinicians for themselves, more efficient, and able to kind of treat patients better, with great outcomes. So I think and again, that's kind of where we're really thinking. I mean, what's interesting when you look at kind of the technology side and going off a little of it, is what are some of the technologies being deployed on the non-clinical side to make kind of the back office more efficient, not only for the dentist, but also for the consumer and the patient, so online bookings, openings on weekends, RCM, through AI, all these other like non-exciting back office stuff, but it really makes the patient journey intersected with the dentist we support much more efficient and much more enjoyable, right? It's like people today, they don't want to pick up the phone and, call a restaurant to make a reservation. They want to do everything seamless where it's like, I can press an app, I get all the information off the top. It's that seamless connectivity, and people want to translate that over to their healthcare needs. And I think dentistry, we've been able to showcase, is something to meet those needs, right? So it's exciting. I mean, I think what you see the highest growth aspect within dentistry right now is on the tech side, and the tech side of servicing the profession.
And what you'll find too is obviously price is always um, something of a focus, right, for most people. But
Yeah,
and it will continue to be so. But when the technology is low, price becomes even more of a like concern, right? Because I'm not even getting good tech, a good experience. So I think really good tech, people are still price will still be a concern, but it makes you feel a little bit better about okay, the experience has improved, even if I maybe even have to pay the same or a higher price at some point, right? Like obviously you hope that's not the case, but I do find that when technology is really good and the experience is great, that becomes less of a concern.
yeah. And I think the other thing too that's interesting is when you kind of look at the claims data of kind of particularly for the patient side of DSOs historically versus private practice. I mean, more and more solo practitioners today take dental insurance, right? Historically, many didn't, right? It was a very cash fee for service, and I think when you look at you know DSOs who have historically taken more insurance and taken certain patients, like in the Medicaid side of things, you know the data shows is people take more insurance, the patient cost is lower to the patient, right? And again, that's our job to work with the insurers too, to say, hey, you know a lot of dental work isn't always covered by insurance because you have a higher deductible, right? So there's another aspect of us working with the insurers to make sure that the patients are receiving the care they want. I think when you look at Medicare Advantage in particular over the last 5, 6 years, more and more people are going on to Medicare Advantage ever than before. I think this year the most ever went on Medicare Advantage, and no surprise, it's the baby boom generation. They're retiring. They're at that age. The Medicare Advantage plans have really solid dental benefits, and so I think that, again, no surprise, people of that category need a lot of dental work. So again, I think the insurance and DSOs taking insurance ultimately lowers the cost within the ecosystem, particularly for the patient. So that's one thing that we're really striving to do and showcase that. So it's it's again kind of showing that information and having options for the patient in order to get the care that they need. So cost, care, and convenience, right? So and making sure that the dentist has that ability to deliver those options.
I love it. Andrew, I want to thank you so much for joining us here today,
Of
sharing
course.
some thoughts, and look forward to future conversations. Thanks so much.
Yeah, absolutely. I really appreciate it.